I'm Dr. Alan Dunton. I'm the Chief Medical Advisor, and I'm also a Director of Recce Pharmaceuticals Limited. Today, I'd like to share with you some clinical highlights from our development program with our lead product, which is Recce 327. And actually, the lead product is the gel formulation. We also have an IV formulation, which has been studied. It's pointed to the excellent safety profile of Recce 327. We've given up to 4 grams of the product without any significant adverse events. We've never seen a serious adverse event with the intravenous product. So that's provided a really good background and understanding of the pharmacokinetics of the product for the other programs. We also have a spray, which will be used for respiratory infections, an inhalation product. We have some excellent preclinical data in mouse models of various very nasty bug infections like Acinetobacter baumannii. But that development is a little bit behind because we decided to focus on the gel product for diabetic foot infections. And why is that? If we could have the next slide, please. Infections of diabetic foot ulcers, next slide, please. It's a very complex environment. You can imagine that, thinking about your feet and your lower extremities. In diabetics, they have problems with their kidneys, they have problems with their vasculature. If any of you have members of your family that are diabetic and somewhat have had it for many years, you'll know that there's a lot of things that go wrong. They're also very susceptible to infections. They don't have good sensations in their feet, and they tend to bang their feet walking, even with shoes on, and those slight bumps can become infected. And it's very difficult to treat infections in these patients. And why is that? Well, they don't have good blood flow to their feet and their legs. So if you give an antibacterial or an antibiotic by an oral route or an intravenous route, guess what? It may not even get there. They also tend to have a very high bacterial count, and there's very delayed healing. As I mentioned, they have problems with their immune system, so healing takes a long time. There's no standard of care of how to treat patients around the world, not just in any individual country. And most physicians who use these patients or take care of these patients, use cocktails of medications, and it's almost like an art rather than a science at all. When even you manage these local infections, as I mentioned, there's no standard of care. But the ideal would be where you could get an antibiotic directly on the wound. And that's why we are using a gel and why we're so excited about it, because our product has a novel mechanism of action. It's very fast acting. If you look in our test tubes and our in vitro studies against all bacteria, first of all, we've never had a bacteria tested that didn't succumb to the effects of Recce 327. And it happens very quickly. It's measured in minutes rather than in hours and to days, what most antibacterial products take to have an effect. And as I said, it has a broad spectrum of activity, and it's a perfect compound to use in this type of situation where you don't even know what bug you're treating or bacteria you're treating at the time. So you don't have to go around, take biopsies and see which bug is there. It's first line therapy that can be used right away. So we designed this Recce 327 gel with this complex situation in mind, because number one, it's easy to apply. You can imagine you open the tube and it can be applied directly. You don't even need blood flow there because the drug is already there. And as I mentioned earlier, it has a very broad spectrum, and it could even work against an infection where you have many different types of bacteria that are present in the wound. So it's a perfect setup for the use of this kind of product. To my knowledge, there's no gel product approved, topical antibiotic product approved for use in diabetic foot infections. So if we can go to the next slide, let's talk a bit more about our product. There's the tube of Recce 327 gel. As I mentioned, you don't even have to identify the pathogen or the bacteria that's being treated. You can use it as an outpatient very easily. Um, and you don't have to expose the patient to a very high level systemically of an antibiotic. If you've ever been in antibiotics, they can cause havoc, especially oral products. They can give you upset stomachs, can produce diarrhea because it wipes out all the bacteria in the gut. Not a pleasant thing to have to take an antibiotic for 7 to 14 days. It's necessary sometimes, but we don't think you have to do it here. You can start with a topical gel early on in the course of the infection, so it can be treated and not, get worse and have some dire consequences. We've thus done testing and I'll come to that later, the actual data, but you can see a response within 24 to 72 hours of the first dose of the drug. You can see a decrease in that redness and the swelling, and you can also see a decrease or you can stop the pus that's formed by these infections, which is basically white cells that the body is sending there to attack the infection. So it's a very rapid onset of effect. And when some physicians use oral or intravenous antibiotics, they can be on these things for weeks. We hope that's not the case in all of our testing, and we have some very good data, which I'll share later in the presentation. It's very safe. We've looked at how much drug is absorbed from intact skin where the drug is applied, or even in these wounds. If you have intact skin, there's absolutely no drug that gets into the systemic circulation. And in a diabetic foot ulcer or other types of infections where there's an open wound, you can see very, very small concentrations, which it amounts to about 50 milligrams given systemically, which is a very, very small dose of this drug. So it's very, very low. And even if it was absorbed, the drug is so safe, as we showed in the intravenous program that we have, there's no ill effects that it causes upon the body. And I've used it on a few infections I've had in my hands and my feet, and it's a clear gel. It's very soothing. It actually feels pretty good, and you can use it once daily with a small bandage on top that's put in place. Next slide, please. So let's move on to this program. It's an interesting history, actually. So the first study we actually did was with a liquid spray formulation of Recce 327. And we studied patients who had diabetic foot infections. It was a hospital it's called Liverpool Hospital in Southwestern Sydney Health District. And we studied a handful of patients out there, and lo and behold, all of them responded to the drug. And in fact, in some of them, over a very short period of time, we were seeing these diabetic wounds actually starting to close and to heal completely, which is an incredible feat. Pardon the pun, but most of these wounds take a very long time to heal. Now, one thing, you need to heal the infection before this open ulcer has any chance of closing. So without this treatment, the patient wouldn't have had a chance to heal their wounds and close it and prevent any further reinfection of the wound. So that we looked at that data and say, well, let's go after a gel formulation, which would be much easier to use. We also did a phase 1 study in patients who had infected burn wounds, and we showed that it was safe. I believe none of the patients had any serious adverse events. One patient had a little bit of tingling. Patients with burns have very sensitive skin. Their nerves have all been shattered, if you will. And there were no serious adverse events in this study. It was done at a hospital in Western Australia near Perth, which specializes in burn treatment. And we were very pleased with that. So by this point, we had a gel which we were going to put in clinical trials, but we also used another way to understand the drug a little bit better. The Therapeutic Goods Administration in Australia has something called a special access scheme, where any physician can request an investigational product to treat their patients under their care, as long as they abide by the TGA's requirements, which is basically to ask permission, and if the company says yes. Well, we said yes to a number of these special access scheme requests, and we saw incredible results. And I think one of the physicians who's an orthopedist in North Sydney used it on a number of patients, and one patient who had an infected ulcer on his ankle. Uh, he saw a response within 24 hours. He was amazed, and that patient went on to completely heal that ulcer in very short order. And he had a number of other very difficult patients that he couldn't cure with oral antibiotics, and he used the gel, and it resulted in a cure. So he's been very pleased with the product and is looking forward to further developments as well. We did proceed to start a phase two trial and complete a phase two trial, at least the first part of that trial, in patients that had something called an acute bacterial skin and soft tissue structure infections, affectionately known as ABSSSI. I'll come to a little more extended data on that, but the the high percentage of those patients, I think it was greater than 90%, achieved a positive primary and secondary endpoint. It was healing of the ulcer from the infection, and the patients did very well. It was safe. We looked at absorption of the drug, as I mentioned earlier, and there was minimal absorption. Um, this study also included patients with diabetic foot infections. They're in the broad category of ABSSSI, and they also responded nicely as well. So we decided to focus on diabetic foot infections going forward, and I'll talk about a little bit more about that in a couple of minutes. But if I can have the next slide, please. So this is the more complete results of that phase two study in patients with infections on their skin or in their skin structure infections. Um, it enrolled 30 patients. There were 29 included in the final analysis. There was a patient that was withdrawn. She had some pain which existed before she entered the site, and the pain became problematic for her, so she dropped out within the first or second day of the study. But other patients went on to complete the study, as I mentioned, these 29 patients, and after 7 days of treatment, 7 days of once daily treatment, 86 of the patients had a positive clinical response, a successful clinical response. And we continued treatment for 14 days, and that number increased to 93% of patients. That's a really astounding number in a phase two trial. This was an open label study, meaning there was no comparator in the trial, there was no placebo or active other antibiotic that used in another set of patients, but still it was dramatically positive to the point that we felt we could move into a phase three study. It was very safe. There was no adverse events or serious adverse events. And I should just point out that the assessment method is something called the Lipsky scale. For the infection, you look at 7 parameters such as redness and swelling and exudate and pus exudate, etc. And they're scored from 0 to 3, three being the worst, if you will. It's really bad. For 7 parameters, you can have a score as high as 21. So a positive in this study was a significant improvement or an absolute cure over that course of therapy. It takes time for the body to respond. You can kill the bacteria in minutes, but the body still has to catch up with the response and you slow down the immune system, if you will, to get rid of the redness, swelling, and in any cases, irritation as well. So we were so pleased with that study, we proceeded to another study on the next slide. If I could have the next slide, please, which is a phase three trial. We were actually working with the government of Australia and speaking to folks in Indonesia because they have a huge problem with diabetes in Indonesia. And they have so many patients that have infected feet. Infected diabetic foot ulcer infections because that environment is very difficult, right? It's very humid. Um, they wear primarily sandals or flip-flops, not complete shoes. Their diabetes, unfortunately, is not treated aggressively. So we began at the end of last year, 2025, a phase 3 trial, which was approved by their local regulatory body in Indonesia called the Biden POM, BPOM, BPOM. And that study has been running now. It's where are we today? Is the middle of March, and we're open at 5 sites across Indonesia, from the west to the east. Um, as you can see, you need to have the population of Indonesia is very diverse, subpopulations, et cetera. So the BPOM wanted us to study across the geography of Indonesia. The primary endpoint here is the clinical response to diabetic foot infection, according again to the Lipsky scale. And the secondary endpoint is the total wound score, which is a measure of how wide and how deep the ulcer is primarily, and also obviously the safety of 327 gel. So we're really excited. We'll be performing an interim analysis this year when we complete 155 patients. We're going to enroll approximately 300 patients total, and then we'll look forward to registering the drug first in Indonesia. But the good news too is Indonesia is one of the ASEAN countries, and if you get a drug approved in one of the ASEAN countries, it opens up the door to all the other ASEAN countries as well to seek approval. So we're very excited about this evolution. And as I mentioned when I started the talk today, we're working in other areas. We have an IV formulation. We also have an aerosol formulation for lung infections. It's becoming very popular now to try to treat patients with an inhaled version of an antibiotic for the same reason we're giving a topical gel. You're getting the drug to the site of action where it is most needed, and you're not exposing the rest of the body to that drug. I think that's the last slide, if we can move this one forward. But I think it is, and I really want to thank you for your attention, and keep your eye out for more good news from Recce Pharmaceuticals. And have a good day. Thank you so much.